Now let's take a look at the LindseyJones CRT RRT Review Manual. And the first thing you probably realize is that this is an awfully big book, and you may be wondering, how do I get all of this information into here? I realize that's an awfully intimidating thing to do, especially when you consider that this book is over 300 pages. Well, it's not as hard as you think, and I want to just share with you some techniques that I've used and that other people have used in order to get a large amount of information in your head and really ensure that you know it. The good news that I'll start off with is that you already know 50 to 75% of this book. Let me just show you what I mean. Okay, so here we have the LindseyJones CRT RRT Review Manual, and I want to just give you a brief tour of the book. So as we go through the book here, I'll just open it up. Right off the bat, you'll run into the table of contents. Now that's a very handy thing to have, and I know it may be difficult to see on the video, but if you'll permit me just to give you a small tour, you'll realize that the basic book is split up into three main sections: patient data, equipment, and interventions. And the important part here is that these are the exact same areas that the NBRC test is divided upon. So if you were to have a weakness in equipment, you could come back to the equipment chapter of the book and help to fortify your weaknesses. Now as I advance through the book here, you'll see that there's an answer sheet for a pre-test that you can play with and try yourself out. And of course here are the answers to that pre-test, so that's just something that's helpful. Now, during this part of the book, when we get to actual page 1 of the real book, we run into the first chapter, which is patient data, also called evaluations and recommendations. And as I turn here, I want to point out what I mentioned before, is that this is a good example, this first page here, of something you probably already know. And so as you look through here, you'll realize that this is about blood gases. And you have CO2 and some basic facts, its proper range, and PO2 and pH. As you read through that, my question to you would be, does anybody really need to tell you what the proper level of pH is anymore? I doubt it. You probably have that committed to memory. Now you should read through every one of these facts just in case something eluded you. But essentially, I will take a page like this, and I've already done it. I'll put a mark across it so that when I come to this page again, I know never stop and study this page again. So you'll go through the book in that way, marking off things that you already know. Now on this next page over here, you'll see that there's a calculation that I know. I can't mark off the whole page, but I can definitely mark off this section. Let me just show you another technique as well that I like to use. I'm just flipping casually through the book. Perhaps I come across this section here. What I like to do sometimes is I will take an open box and write it in the corner that way. And I know that if I have an open box, meaning there's nothing in it, that I have stuff on that page that I still need to memorize. Even if I have this crossed off, maybe there's something here that I still need to study. But once I have the whole page, rather than cross off the whole page, I could use this technique. I could put an X in this box, and I would go from page to page doing that. Maybe here's another page that I know everything, so I have an X in that box, and then as I flip over the next page, maybe over here I have a box that still does not have an X in it, so that I know that I need to study that. That's an easy way. Then as you flip through these pages, you can very quickly discover what you know and what you don't know. The idea here is that you can systematically go through this book page by page, understanding what you do know and making sure that you understand what you don't know so that you can put some effort into studying that. And this way, you can get through the book rather easily and in a methodical way, get every bit of this information in the book. Now I understand that you're not going to know every single detail in the book, but my general recommendation is that you go through the book in passes. On the first pass, rather than stop and study and memorize, you want to just go through that pass with the sole intent of just marking off things that you already absolutely know. On the second pass, now that's going to be a time that you stop and you study and you memorize. You memorize this list or this list of hazards or this list of contraindications. For you, it also may be practicing calculations over and over. Now, just a word of advice here. As you memorize or you think you understand something for the first time, you've got it committed to memory, don't necessarily cross it off yet. You really don't know if you know it until the next time you come through the book. Eventually, as you go through pass after pass through the book, you'll realize that you have fragments of information here and there all over the book. What I do at that point is I open up something like a Word document and I begin taking my own notes from the book until eventually I can take this book and I can shut its cover forever. Then all I have is my own notes. Now again, you might have 10 or 20 pages of notes, But you'll study that every day, and eventually you're marking stuff off of that until right before the test you have maybe 3 or 4 pages of notes. Even I always have at least a couple of pages worth of notes. For me, it's typically trying to memorize pharmacology. For you, it may be something else. But I cram those notes right before I go outside the test. So the general rule is to go through the book in passes until you've ensured that you've got that information. And keep in mind, if you've marked it off, don't stop and study that information anymore. The conclusion is that you can assimilate more information as you go through the book pass by pass. I also just want to make one final note. Sometimes we get asked, why don't we have a workbook that goes along with our manual? After 20 years of doing this, there's something I've discovered. We've realized that when people have workbooks, they have a tendency to open up the manual and simply regurgitate the information from the manual over to the workbook. And after they've completed the workbook, they sometimes have the false sensation that they have everything in the book in their head, but all they've really done is transferred over to another manual. So we choose not to use it, and we find it more effectively when you just study with the book.